So we've been talking about the 6 ways to treat, promote, and improve human health. We started out by talking about exercise, and we realized that exercise has proven to reduce heart disease, cancer, improve circulation and increase energy, and improve brain function. We also went into nutrition and diet, and we talked about how studies have shown that we're not getting enough nutrition, or we're not getting enough of good nutrition, and some of this could be due to the fact that the soils are not as as good as it has been in the past. But even with that, we're still not getting the right amount of nutritional foods that we can put into our bodies, such as a lot of good vegetables and fresh fruits and things like that are very, very important for the body to really function better or function at its maximum potential. As a result of that, we find that many people or many doctors and nutritionists are advocating and strongly urging that people take vitamin and nutritional supplementation to ensure that they have better health. Then we dove into the medical chemical aspect, and we talked about the drugs. And we know that we talked about how more than 2 billion prescriptions are written each year. And we know that the pharmaceutical industry is about more than a $49 billion industry, and unfortunately causes about 119,000 accidental deaths due to side effects from prescription drugs. And we know this, and unfortunately people just blindly many times just go and take all kinds of medications. And one of the things I've experienced over the years is especially with my senior patients who come in and they have a cabinet full of medications and have no idea what those medications are for. And so one of the recommendations I make for a lot of my seniors is that when they do go to their medical doctor, to make sure they take one of their children or someone a little younger that they can go in and sit with them while they're with their medical doctor, and actually ask questions about what medications they're taking, what are the problems with them combining different kinds of medications that could create a whole lot of health problems because of the side effects. So it's important that we make sure that when you do go, ask a lot of questions. Maritza, how you doing there? Please, all of you out there, really would appreciate if you, much like Maritza does, is make some comments in the chat box, and we would really appreciate that, and we'll get back to you. And if you have questions, just let us know. So make sure you ask questions, and also you want to know about the potential side effects. It's very important. Today we are in an era where opioid addiction is at a high. And we see so many people out here that are dying unnecessarily because of the opioid crisis that's going on in America today. And then the next one we talked about was surgery. We know that there are probably more than 50 million surgeries a year that are done. And again, that needs to be something that you seriously consider. I'm a firm believer that when it comes to emergency type situations, I would think that America is probably one of the best places to be when those kinds of surgeries are necessary. But then we have to look at the pros and cons of that. We see today a lot of people are going towards elective type surgeries, gastric bypasses, things of that nature, because they want to lose weight, but they don't have the discipline to do what's necessary to actually help them get to that point. And sometimes those elective surgeries could turn into a nightmare for some people. Again, everybody's got to make their own choice, but my thing is this: ask questions before you go into doing those kinds of things. Then we moved a little bit into the emotional mental aspect. Okay, there are a lot of people out there, and I'm probably in there also, where I believe that just as we know, and you can let me know if you agree with this or not, or some of your thoughts, that if thoughts can make you sick, right? If thoughts can make you sick, then to me it seems possible that thoughts can also make you healthy. So that means if you're thinking negative, bad thoughts, like for example, the last 2 years that we've all gone through with this crisis that we've been dealing with in America and around the world, that has created a lot of stress in people's lives. Would you agree with me? If you agree with me, say something and put something in the chat box. So we know that stress is probably at an all-time high for just about everyone on the planet today. Okay, and so we know that with those kinds of stresses, they're going to have an impact. And so I look at it like this: when we have stress, your body, your brain nerve system has the ability to adapt to stress. What really makes it difficult for the human body is when we encounter prolonged stress. So stress that continues to linger around can, over time, can put a lot of stresses on body systems and cause your body's systems to start malfunctioning. In chiropractic, we talk about how when these types of things occur in the human body, they create what we call dis-ease, okay, a lack of ease in the body. And so what we realize is that if that dis-ease hangs around for a long period of time, it could, over time, turn into what the medical doctors or the field call disease, okay? Where now the body has developed something where is going to need some more attention to deal with those kinds of problems that may be going on. So what are some of the stressors? It could be depression, low self-esteem, could be anger. So in those cases, we want to consider lifestyle changes. Some of those lifestyle changes could be exercising, going back to what we talked about before about exercise, make sure you're eating right, making sure that you do things like meditate, maybe go out and walk, walk by. If you live where we live in the South Jersey area, we can go to the ocean, go by up on the boardwalk and walk and just kind of, just be a part of nature. You can walk out in the woods, you can do things like that, just to help the body to deal with those stressors, okay? So when we talk about the brain and nerve system, tonight we're going to be getting into that aspect of what we call biomechanical or structural. One of the things that we want to understand is that 90% of stimulation and nutrition to the brain is caused by the movement of the spine. So that's why I want you to really understand the importance and significance of being under chiropractic care. Most people, when they decide to come to a chiropractor, what motivates them many times is going to be pain, right? But once we understand what is going on in the body, we want to educate you about the significance of making sure that your spine is in proper alignment. Why? Because when your spine is in proper alignment, your brain is going to be able to communicate to the body, so from brain cell to tissue cell, more effectively when there's no interference going on. So we use this little model here to show two vertebrae, okay? We have the disc in between the vertebra, and we have the spinal nerve, this little flickering light. Some of you can see that there. That represents the actual spinal nerves coming off of the spinal cord that is inside the canal here. And so these vertebrae, when they're properly lined up, your brain is able to communicate to the spinal cord, then to the spinal nerves, and to every organ, cell, and tissue of the human body. And so when we're under stress, and remember I said when there's an over production of stress, or if the stress that we're dealing with is prolonged, it will send a signal to the body, a stressor, and those muscles and ligaments that are connected to the spinal vertebra or the bones of the spine, and they can contract and actually pull those vertebrae out of alignment, putting pressure on the nerve, compromising the brain's ability to communicate with the body. Okay, so what I want you to understand is that you could have these going on, and I would say probably in most cases you could have this going on within your system and not feel any pain at all. And while this is there, right? While this is there, it's much like the front end of your car. If it's out of alignment, what happens? Those wheels are going to, your tires are going to wear out unevenly. And if you don't get that front end aligned, much like we think about getting the spinal system aligned by bringing these vertebrae back into proper alignment, taking the pressure off the nerve, now your brain and nerve system has the ability to do its job, right, of sending the right information to the right parts of the body, and even sending information to allow the body to heal itself in a natural way. But when those are out of alignment, then that system over time will start to have a breakdown, and as a result of that breaking down could cause many things to happen within your system. one of the major things that we see happening within the spine is that over time we'll see degeneration occurring. We may even see today, more than any other time I've seen in history in terms of my practice, is we see young people coming in what we call anterior head translation. Another term that you see, and it's very common today, is called text neck, because they're constantly on their cell phones, they're on their iPads, and you probably see it yourself if you're walking around any city, whether you're in Philadelphia, New York, whatever. You'll see more people walking around with this, with their head down, and really not paying much attention to what else is going on around them. You know, doing that day in and day out for weeks, months, and years, given the weight of the human head, anywhere from 13 to 18 pounds, is like a bowling ball that's sitting on top of your shoulder, and this neck here trying to hold it. Over time, it's going to cause some degeneration within the spinal system. We also have to keep in mind that as the head moves forward, we're putting a lot of pressure on the vagus nerve, and we know that the vagus nerve has a big role in terms of having, sending impulses to your heart, your lungs, okay, your liver, gallbladder, your adrenal glands, your large and your small and large intestines. So it impacts a lot of different areas. And you and I, as we're walking along, living this life, if we don't go and consider connecting with a chiropractor to help us understand what's going on, then we'll be the people that in their 30s, 40s, and 50s will wind up having initially an acute problem that now over time, because the problem has never been addressed, will have a chronic condition. Okay? So the beauty of this is this, like, we know that because the spine is important, that it needs to, and that it affects many areas of the human body, that it becomes important that we get our spines checked and get them realigned on a regular basis from the time that you're a child or a young baby. And I got a story to tell you about that's very, very important, that we know that when the spine is out of alignment, it can have a serious impact. So I had an experience last week. I want to share the story with you. Went to, and I won't use any names because with HIPAA laws we can't do that, but there was a young person I went to see in a wheelchair, had MS, and went to give her an adjustment, okay? Give this patient an adjustment. And after I completed that, they presented me with a young 2-month-old child who informed me that was not able to, pass their bowels, and was crying, had a lot of stuff going on. And what I did was, hey, I gave that little 2-month-old an adjustment, just using just a little tip of my finger, and just working with their spine and their pelvis. And I left, and about 45 minutes later, I got a text message from the parent and was elated that she said that that child had passed the largest, it may sound vulgar to you, but for a mom, you will understand what I mean, that had passed a huge amount of bowel fecal matter. And she was just like, the baby was just so, everything changed, and then the next day I got another text message from the parent and indicated that, hey, the baby slept like a baby, right? Slept all through the night, had just smiling and just very happy. And by the way, she had also indicated it was her first adjustment that she was able to sleep all through the night. Okay, so I'm saying this to you because I want you to understand the value and the importance of the chiropractic adjustment. And I'm telling you this. Look, I've been under chiropractic care since I was 19. I am 69 years now, 69 years old. So you can do the math. It's been a long time, and I make sure that I get adjusted on a weekly basis, and I make sure that my wife and my children get adjusted on a regular basis, usually once a week. And I think that is something that everyone should consider doing for the duration of their lives. So again, we want you to understand that there are 24 movable bones in the spine, okay? And these bones are there to protect the spinal cord, the spinal nerves. We have this cranium here that is there to protect your brain. And this is where the life energy and messages run through the spinal cord to the nerve and to every organ, all the tissues, and over 75 million cells that this body is constantly communicating with. And we know that spinal misalignments can cause God knows how many problems, and not the least of which is pain and discomfort. Can reduce brain function, it can lower immunity, and it can also cause many other health problems. So for that reason, we think it's very significant and very important that we, on a regular basis, get our spines checked, okay? So if you have any comments, please put some comments in the chat box. I see Maritza there. So it says my class was canceled, so I'm here. Monique Green, it's good to see you. Really miss you also. And so, as we move through this, our goal over these past few weeks was really to stimulate some interest in ways in which you out there can start doing things to take care of your body. I really do believe that it's so important that we understand the value of natural health care. You understand that we have to understand that natural health care has been here longer, since the beginning of time. Okay? And so I think that when we think about healthcare, we should really, really think about moving in the direction of doing things natural before we start going out experimenting with a lot of these chemical drugs and things like that are out there on the market today. I'm a big advocate. I've been in practice now for 37 years, and I could tell you there's been so many stories over the course of my time in practice of things that I've seen happen to patients who come in with all kinds of ailments. And as you know, chiropractic is not about telling anyone out there that we cure anything, because we don't. We firmly believe that the power that made the body is the power that heals the body. And what we mean by that is that there's an innate intelligence within the human body. Okay? And that intelligence knows exactly what the body needs. And the only time that it cannot do what it was designed and programmed to do is if we have some outside factors that are interfering with your body's ability to function properly. So what does that mean? We talk about maybe negative thoughts, right? It's emotional stuff that's going on in our lives that can have a serious impact on our health. We know that trauma can play a big role in having a devastating effect on human health. So that means, we look at sport injuries, motor vehicle accidents, accidents that occur around the house, and walking down the street and slipping on a curb that you didn't see, and all these things have an impact on us. Riding a bicycle, falling off, that's a trauma that has occurred to the human body that can actually have an impact to your brain and nervous system. And the last thing would be toxins. Okay, we live in an environment that we're surrounded, bombarded with toxic chemicals everywhere. I remember going to a person's house, and I just walked in there, and as soon as I hit the door, before I hit the door, as I'm approaching it, I could smell bleach, Clorox, and unfortunately, people don't realize how many chemical toxins that we use in our homes to clean our homes, that the gases that come off of those chemicals causes some serious damage to our lungs. And God forbid, if you have children in your home that have to smell that all day long, God knows what that is going to do. We know what it does, but it's important that you out there understand the devastating effects that it has on your internal organs, your breathing, just all kinds of things that can happen to your body over the course of time. So just think, if you're doing that every single week for God knows how many years, what devastation are you causing yourself And what are you doing to your children and your husband, your spouse, whoever lives in your household? So we have to start thinking, what we can do. What are things that we can do? Well, one of the things we can do is start using healthier products, green products that don't have those chemicals but do an effective job. One of the things it amazes me when you look at a bleach a bottle, the container that it's in, it has all kinds of stuff in it. People with masks on telling you that this is how you should use this stuff. But how many people read the label and really get a good understanding about what those chemicals or how toxic that chemical is for their body? So as I said, thoughts, trauma, toxins, those are the three impacts that we can have to our bodies that will cause your nerve system, okay, to become scattered, and over time it will cause the system to malfunction. And if we allow these things to continue to go on, then it's going to cause your body systems to start to break down. All right, they'll start to malfunction. If that malfunction continues to be there and you don't do anything about it other than medicate it, because all medication is going to do, and not knocking medicine, but when you suppress a symptom, and remember, the body was designed to feel. Okay, the only way that you're going to know that your body is functioning well or not is you got to be able to feel. But if you're numbing your body with medication, and granted, I know there are people out there who are in a lot of pain and they have to do stuff. But I'm saying this, that while you're doing that, it's so important that you be under chiropractic care to get your spine in proper alignment, make sure you keep it in alignment for the duration of your lifetime, so that your body can adapt more effectively to whatever you're dealing with in your life. Okay, so I think it's important. I just my view of the world. I just believe that everything that we need to function, I believe that our Creator, or this innate intelligence, or universal intelligence, however you want to call it, that intelligence that is inside of us will, in its own way, will be able to do what is necessary to have that body become healthy. Okay, it's just what I firmly believe, that if we keep our nerve system free of nerve interference by removing subluxation, then your brain and nerve system will do what it was designed and programmed to do, to provide your body with everything it needs, provided that you're eating right, you're getting proper rest, you are exercising, you are making sure you're getting your spine properly aligned on a regular, consistent basis, right? And you also are engaging in life. You're engaged in life. We live in a world today where there's so much negativity going on. People get up in the morning, they watch TV, you get filled with a lot of negativity, to the point that many times people don't even want to go outside anymore. But you have to engage. The body was designed, God created the body in such a way that it was designed to really connect with other human beings. All right, so it's important that we understand that. It's important that we become really mindful, and also be willing to be students, to learn, to understand more about how the human body works, so that you can better care for it. I'm a firm believer of the living the 100-year lifestyle. So what that means to me is doing all the things that we know that we can do to allow the body to function at a high level, so that you're doing the things every single day, exercising, eating right, sleeping right, having a positive mental attitude, keeping your spine properly aligned. We do those things on a consistent, everyday basis. And I firmly believe that even if we don't live to be 100, we'll live a quality lifestyle, because we're doing the things that we need to do. To me, it's all about intentions, making sure you're intending to do the right things, and I think the right things will begin to happen for you, and you'll start pulling in and attracting those things that are really positive for you. So I hope that you really got some good information from this tonight. So what I want you to understand is that one of the things that we want to do, that in our effort to educate the community about what we do here, we want you to know that those of you who are listening, if you have friends out there, that over the next 2 weeks you can call the office at 609-383-9121 and let them know that you were part of this presentation. And even if you were to share this with other people, let them know that when they do see this, they can actually call the office and we will invite them in for a complimentary consultation and evaluation. So if you or someone you know, that offer is out there for you. So I want you to know also that in next month, the second and fourth Tuesday of the month, our next topic is going to be my daily rituals. And we're going to talk about why it's important to develop and have daily rituals to get you through your day. All right? And so I'm going to share with you my rituals that I do consistently. And there'll be sometimes I may miss a few things, but on a consistent basis, I'll share with you what my daily rituals are, and hopefully you'll gain something from that. In the meantime, we really, really appreciate you guys out there who have participated, and we hope to see you back here in 2 weeks. And that next time we'll be on here will be June the 14th and June 28th from 6 to 6:30 p.m. And please share this with all your friends and your contacts. Have a blessed evening.